Good morning and thanks for waking up to Sunrise at Sea. My name is Kieran Atozo. Now once again, I'm back at Kampala Hospital and this time I'm with the head of radiology here at Kampala Hospital and his name is Dr. Innocent Tugume, and he's going to give us an insight in regards to what radiology is, when you need to do a scan or go for a radiology scan, I should say. So joining me today is Dr. Tugume Innocent. Good morning, sir.
Good morning. How are you, Kira?
I'm okay. How are you?
I'm glad. I want to thank you for having me on your TV.
Thank you for making time.
Yes.
And Happy New Year.
Happy New Year to you too.
How is work?
Work is not bad.
Yes.
We had a busy year, 2020, the 2021
Yes.
due to COVID.
Yeah.
We're glad that things kind of phased out a bit, although we get information that they're coming up, but at a mild stage. But as as part of the health partners, and we are ready. We're ready to treat and take care of people, even through this season. So just a small shout out. I say you continue with the SOPs and the masks and the treatment where necessary.
Yeah.
As far as health is concerned, we're really set for you.
Yes. Now today, doctor, given the fact that you're head of radiology here at Kampala Hospital, however, certain people, I didn't know that an MRI, actually not an MRI, an ultrasound is part of radiology.
Oh,
yeah. An MRI, people actually go for MRIs.
Yes.
People go for scans,
Yes.
X-rays, and they're exposed to all this.
Yes.
Yeah. However, I want to kick off and ask you, what are some of the importances of doing a radiology scan for health purposes? What are some of the importances?
All right. I would say previously, we never had, when we didn't have diagnostic services, it used to take a physician, maybe a general doctor, to first listen to your symptoms to determine what could be affecting you. Now, with the advancement of imaging, this has helped the doctors get to know what the problem is and perhaps treat you exactly, give you the treatment that is very beneficial to you. So this is where ultrasound, X-ray CTs, and other investigations, MRIs, have come in to help the doctors.
Yes.
So maybe for the information, I can break down for you.
Please.
Your question was, you didn't know whether ultrasound is part of radiology.
I didn't know.
Yes, ultrasound is actually one of the modalities that we offer in radiology, and it has different sections. We have the obstetrics, the one we do for mothers who are pregnant. We follow them up from the beginning of their pregnancy up to their late stages.
Yeah.
And within the obstetrics, we have things that we are supposed to see that help the gynecologist, for example, determine how your baby is progressing. Even in ultrasound, we've advanced to 3D, 4D ultrasound, and quite those equipments are available in this country.
Yeah.
And Kampala Hospital is, of course, one of them with one of the best ultrasound equipments on site. So this has helped the doctors be able to narrow down what could be the problem, and has helped healthcare get you treated much faster, much easier, without eliminating the guesswork situation. Yes.
Being exposed to rays, or should I? Is it rays? Is it called rays? Yes. Being exposed to this now, for instance, a woman that is actually pregnant.
Yes.
How often should one actually be exposed to this? Don't they have any risks that come with it?
Oh, okay. So now in radiology, we have some exams that use radiation, which are the rays.
Yes.
And then we have some that don't. So ultrasound doesn't use any X-ray radiation. It just uses sound, just like I'm speaking to you. So it's quite safe in pregnancy and quite safe for every other person. So it's quite an non-invasive, non-radiative exam. So it's highly recommended. It doesn't matter how many times you do it, as long as the doctor has requested it, it could be done for you. Okay. Yes.
I used to be scared of, being exposed. Okay.
It just uses sounds and allows us to see what's happening inside you. We get to see your organs, see how how they are performing, see whether there's a problem, and inform the doctor who is treating you
Yeah.
on what steps he should do.
When would you recommend for someone to go through the radiology process? Under what condition or steps should actually one go through this?
Oh, well, that is it's a bit broad, but what we do is usually we work hand in hand with our physicians and the general doctors.
Yeah.
So they make the requests. You go to them, and they see the need, and once they narrow down what your problem is, they feel you could be benefiting from X-ray, you could benefit from an ultrasound,
MRI, yeah.
or you could benefit from an MRI.
Yeah.
Exams like MRI, CT are on the advanced end. So, for example, you could have done an ultrasound or an X-ray, and the doctor feels they need to get more information, so they may send you for a CT, or they might send you for an MRI.
Yeah.
Yeah. So,
What are some of the caution aspects of a diagnostic radiology?
Repeat the question.
What are some of the caution
Cautions,
aspects?
yeah, yes,
What are some
yes.
of the
Now-
cautions that someone has to look out for before they come and do all the CT scans, all the ultrasounds, all the MRI? What are some of the aspects that?
So
one needs
caution really, I would say for some exams, like say for example ultrasound, I said it's non-invasive, so you're free to come in at any time and do it. X-ray uses radiation, and radiation has a risk that it can cause cancer, but after accumulative effects. So you coming for an X-ray, you need to be advised by the doctor. That means you have to, and that means we have weighed that the X-ray is beneficial to you. Yeah, and the effects are not that much, but if you keep doing them over time, there's a chance that they could mutate cells and pre-expose you to cancer.
How often are we talking about when you say all the time?
It's quite rare, but assuming you came in for 50 X-rays a day, that's quite a, or no, 50 X-rays a month. It's quite a lot for anyone to consume. Just like us who work in these radiative areas, we have these badges. I think you can see.
Yes.
The purpose of this is to monitor my X-ray consumption. If it feels my consumption has gone above, I'm first exempted from work for some time to allow the dose accumulation to go down and allow me to practice again. So we monitor ourselves because we work in the radiation center. Then for MRI is a magnet, a very huge magnet and very strong magnet. So we really take precautions for people who have, for example, earrings. You have to remove all the metals you have.
Yeah.
Then if you have a pacemaker, you don't qualify for an MRI.
If you have a what?
A pacemaker, there are people who have heart problems and they have some equipment that are supposed to help their heart.
Yes.
Yeah, you might not go in for an MRI. And if you've done like hip replacement, they put in some hardware, or you have some nails from previous fractures, an MRI might not be a solution for you because of the metal and magnetic element that is there. Yes.
Yeah.
Apart from those who use titanium metal is the one that is compatible for MRI.
Yeah,
so you might do an MRI if they used such but
So-
majority don't use titanium. They use actual metal, which are not.
So what does a person have to do if the doctor recommends them to do an MRI, but you already have all these metals embedded in you?
Usually we advise, if they come in, we advise. The alternative would be you doing a CT scan because it doesn't have any problem with metals. Eh?
But the results are the same.
No, an MRI would have given a better result, you understand? But a CT becomes the compromise. Like, at least it will get them some information to have somewhere to start from.
Okay. Any last remarks for someone that is watching you right now when it comes to radiology? What's that one thing that you would want them to know?
What I can tell you is I've had, I just want to address a myth.
Yeah.
There's been stories around where they say if you came here and did a radiology exam, you lose it reduces your years.
Yes.
That is not true. It's not true at all. There's it doesn't reduce years, it doesn't increase years. It just exposes you to chance of getting cancer, but it's a rare condition because what has happened is with these new advancements, the equipments that we have,
Yeah.
they are reducing the dosage, the radiation dose to the patient. And we monitor them. So we make sure that what we give you is adequate enough not to cause you any problem in future, yes.
Okay.
And one of the other information I'd like to pass is if you expecting, if you're pregnant, an X-ray and a CT might not be done on you. So if you come to hospital and we find out you're pregnant, we might advise not to, unless the doctor has said the benefit outweighs the risk, and we usually give you a consent form for you to sign. Say, for example, you're a pregnant mother, but you've had a bad accident. They want to know whether your head is bleeding or something. Sometimes that's when we have to bring in the consent and weigh the benefits, and you end up here.
Well, thank you very much, Dr. Innocent. It's been a pleasure having you on this part of the show. I have learned a couple of things. You know, I was always worried when it comes to doing many, going under the scan or doing the scan so many times, being exposed actually to these radiations. I was so worried. And just like I've learned one or two things, I'm sure you've actually picked up one or two things. And it's not a myth, just because you come and do all this radiology, if you come to see a radiologist, doesn't mean that your span of life is actually going to be reduced, yeah? So go see your doctor if need be. If you have any injury and you need to figure out exactly the root cause of what could be causing that, please see a radiologist, yeah, to make sure this doesn't blow out of proportion, yeah? Well, that's all I had for you here in Sunrise at See you next time. Keep watching SICK TV, and good morning.